Good evening, everybody. This is Darius Assemi, your host at GVWire Unfiltered. Welcome to another really hot episode. It's cold outside, but this is going to be a really hot show. Um, we're going to talk about a lot of interesting things. We're going to start off with Fresno Unified. I'm sorry, not Fresno Unified, the other Fresno Unified, which is really guns in California. Leon Orndoff, owner and operator, Gunsmith at Attack Cover Tactical, Duck and Cover Tactical is with us this evening. Good evening and welcome back, Leon.
Thank you,
Uh,
thank you, thank you.
we have Trustee, Fresno Unified School District, Susan Wittrup, that is with us this evening. And also welcome back, Susan Wittrup,
Thank you. Thank you
to
for
this.
having me.
Thank you to the program, and of course Emily Brandt, first time, and Larry Moore. Um, Larry, former president of FTA, and which is the Fresno Teachers Association, Fresno Unified Retiree. Emily Brandt, Fresno Unified Retiree teacher extraordinaire of many years. Um, so, anyhow,
Thank you.
those are our guests this evening. Let's see if you have, again, as usual, if you have comments, please put them on Facebook. I will try to get to them. But we're going to start off with a few cool things. First, weather. We have a lot of snow coming our no snow coming our way. 60s all the way through, but it's getting close to frost, freezing
Mhm.
later this week by the weekend. So kind of a little overcast, a little bit of sunshine, but we got a lot of rain already so far. First poll: do you get your news from TikTok? If so, do you think billionaire majority stakeholder Larry Ellison influences TikTok's algorithms? So the first answer is I do not use TikTok to get my news. That's majority, over 60% of respondents to the GV Wire Facebook poll. Okay. And by the way, who is Larry Ellison? Let's put slide 5 up. There he is. Third billionaire in the world, worth over $240 billion.
Hmm.
Very strong supporter of some foreign policy issues, including state of Israel. Uh, and he just became a 30% plus or minus owner of TikTok. So I think everything we say he talk about, read, and maybe even think some of our tech companies, in my opinion, can know even before we think about it. Where do you get your news, folks? Digital news websites. TV is really dropping off. So some of my buddies say, "Hey, why aren't you advertising on TV?" I said, "Well, because most folks don't get their news or watch programs on really regular TV. A lot of streaming news along with programming." Federal immigration officer shot to death 37-year-old woman in Minneapolis. What is your opinion of the killing? It's kind of split, but almost 50% said it's like President Trump said, the ICE agent was acting in self-defense. So again, this is a poll on Facebook on GV Wire. So it's, that's the degree of its scientificity, if that's the correct word. We have a lot of teachers here. I'm sure they'll correct me. um, but 44% said it was an act of unrestrained violence by ICE. Okay, we'll leave that up there for a minute. Do you support the U.S. government using your tax dollars in conjunction with Israel to force Palestinians out of Gaza and into Somalia? If that were to happen, I know there's some rumors that that's what could happen. You lived here for 3 or 4 generations, 10 generations, 20 generations, and now you're going to pack up. By the way, they're Semites. I think the Palestinians that live there, they're for sure Semites. Again, in my opinion, you're going to pack up, get out of this place that we bombarded, and move to Somaliland or some other place. Keep that in mind in the coming weeks as we hear more from on the international scene. I wanted to just spend a minute before we get into Fresno City Council update from President Karbasi, and of course then to Leon Orndoff. Let's put a map of the world up. There we go. So here's a map of the world. You can see Venezuela and Cuba is kind of in our backyard. So, did it make sense for us to make sure that it's going to be friendly government? It's got a lot of oil reserves, but is it the number one in the world? So, did it make sense? It's in our own backyard. Why should we not have it controlled 51st state or control all the action in Venezuela? And then you have Cuba right off of the coast of Florida, which is, 80 miles or less away. And then on the other side of the world, you have Ukraine, the yellow. I know it's tough to see on a small screen, but Ukraine is that kind of yellow, kind of rectangle next to the big red Russia, largest country geographically by square miles in the world, on our planet, I should say, is Russia. So Ukraine is in its backyard. And then you have China, south of Russia, and a tiny, tiny island of Taiwan is attached to it. If I can have Larry mute his microphone, that'd be great. Okay, thank you, Larry. So you have Taiwan. Is there a deal made? We know that there was a deal made. This was all over the news over the weekend, that the President Trump, connected with Vice President of Venezuela, said, hey, over the last few months, we're going to come in and kind of restore democracy or rule of law and restore your economy, and we need your support to make this transition. And Nicolas Maduro said no, so they went to the vice president. So just think about it. And of course, the last question, if you can put the map back up, you have this Iran question. Iran right there, green, kind of in the middle part, in the Middle East. China and Russia have a good relationship with Iran. China needs Iran's oil. Iran, brutal regime oppressing its people. Israel wants, Iran to be destabilized. Everybody talks about we want democracy restored in Iran. I'm not sure that's going to happen, by the way. These thugs who are running the country, they are overthrown, which sounds like they're close to being overthrown. If there's not a good replacement, and there's multiple folks, which we're going to track down and share on GV Wire, that some are imprisoned in Iran right now, some are outside of Iran, Nobel laureates, by the way. That could be a popular support, folks popular people to run the country. The question is, will the West, United States, and Israel, by the way, Israel green light someone like that, or would they want like a Reza Pahlavi, who has, I don't want to say pledged allegiance, but has already said he's going to be following President Trump, and Prime Minister Bibi Netanyahu's lead of Israel on how to kind of manage Iran. So things to think about. Leon, did you have your hand up, or is just a no? Okay. So now with that, let's go to see if there's any questions. No questions. Let's go to City Hall report by Council President Karbasi, and then we're going to dive into the latest gun laws impacting us Californians.
Hello to our Unfiltered audience. This is Mike Karbasi for the last time as the Council President, and that gets me to the main item. This Thursday, January the 15th, we have a council meeting at 9 a.m., and the biggest thing on the agenda is the Council Presidency and Vice Presidency. So typically, it'd be a rotation. So the Vice President would become President. We changed the rules effective this month to where it's a free-for-all. I've heard in the past that free-for-alls have taken as many as 26 individual ballots, but I really hope we're a much more cohesive group that will come to a consensus much earlier, no drama, and keep the progress moving. But yes, it's been an honor to serve for the last year, and I look forward to the council making its decision. And the way it's going to work is, instead of it being a rotation where the vice president becomes president, it will be a nomination process, and hopefully we can get to somebody with 4 votes fairly soon, or more. and move on with the rest of the business. Not a whole lot of other things on the agenda, a lot of boilerplate standard things, infrastructure items and whatnot, but nothing that really stands out. That's probably going to be the biggest thing on the agenda. And then I'll be back with you next week as a council member, as always, to report what's happening here at City Hall. Thank you so much. And 2026 has been an amazing year ahead. I look forward to all the promise. 2025 was terrific to serve as president, and look forward to the work ahead. So back to you, Darius.
Thank you, Mike, for that brief update. So City Council is going to pick who's going to be its president, kind of like a chairman of the board, and vice president on Thursday. Okay, with that, let's dive into Leon Orndoff, the owner, operator of Duck and Cover Tactical, a lot of background, gunsmithing, guns, ex-Marine, a lot of other attributes. Kind of, Leon, welcome back again to the show. Kind of walk us through the latest gun laws. I guess some of the guns that people had last year are illegal now.
Not necessarily. First off, if you already owned it, you legally acquired it, it's still fine. I think we're talking about the Glock ban is kind of what we're going on. I believe that was 11/27. Can't remember correctly on that one, but that one, unfortunately, what's happening, and that just shows you why we have as many attorneys in California coming to California to fight these gun rights. That had a nationwide effect. Kind of what you saw on that one was California raising a stink about Glock or the cruciform triggers. That had a nationwide effect. Glock said, hey, you know what? Generation 5 and down, we're not making them anymore. We'll make the Glock Gen V, and they just recently released the Gen 6. So things that happen in California have a nasty habit of going east when it comes to gun laws. If you own a Glock already, if you own a Shadow Systems, those were the two main ones on the roster, or what the DOJ released. If you already own them, you're completely fine come July. You still can keep them. You still can have them. It's not illegal to have them. You are good to go. However, after July 1st of 2026, you will no longer be able to get those firearms in California until Glock hopefully releases their Gen 6 and gets it on the California roster.
So if you own a Glock 19, the most popular gun on the planet, and the Californians get the second generation, do you have to modify it? Do you have to turn it back in? Can you keep it? What?
You can keep it. It is completely yours. You're 100% legal. You just will not be able to purchase anymore. And especially since Glock has said, hey, Gen 5 and down, we're not making them anymore. You might struggle in a year or two looking for parts. You might struggle, getting that firearm repaired. I haven't seen the compatibility list from Gen 6 to 5 and below. So it's still a question right now.
Sorry, I got.
I lost audio.
Sorry. Anything else? Anything else gun owners should be paying attention to?
Yes, right now, we just had a whole new release on firearm accessories, and it was broken down into 3 different things, and this is all the buzz right now and all the rage. The 3 topics that they had on there was manufacturing machines, barrels for firearms, and firearm accessories. Now, 2 of these things were very well defined. The manufacturing machine, that was very well defined on what those are, what they're used for, and everything else. These are CNC machines, 3D printers, as well as digital files that you can and cannot have. And if their sole purpose is used for firearm manufacturing is how it's worded in the DOJ letter. Barrels, they did a wonderful job explaining, hey, if it's a barrel, you have to go through an FFL. You can no longer have that shipped to your house. Same thing with the CNC machines, mills, or anything else that is specifically for manufacturing firearms. Where the water gets muddy is firearm accessories. And this is, again, put a whole precedence in California, confusing a lot of companies, which is why a lot of gun owners that want certain accessories, Magpul, Strike Industries, a lot of different companies, Geisley, has blatantly just said, we're just not going to ship to California. We don't want to dig through the red tape. We don't want to get sued. And on top of that, that conversation of what defines a firearm accessory is not clear at this time. as it's written in the letter that I got, it said anything that can increase the rate of fire, as well as anything that makes the firearm reload faster. When I spoke to the DOJ about it, basically I got told use your best judgment. There is no clear definition of that.
That's interesting.
And if I make a
Anything-
mistake, I get 10 years in jail.
Is it really?
Yep,
Wow.
it could be
Wow.
up to 10 years if I make a mistake.
Wow.
So what that
Okay.
means for the people of California, if you're looking at getting that AR upper sent to your home, you have to go through an FFL dealer. Any parts right now, as it sets right now, as of this day of January 13th, anything that is pretty much being sold, that anyone feels is a firearm accessory because it's not defined, has to go through an FFL now.
Got it. Anything on ammo before we wrap up?
Just the usual taxes,
Okay.
20%. That's it.
That's right.
They do have something in the works which we're getting some traction on as far as the ammo background checks go. Hopefully that stops. Okay. But as of right now, we're still running background checks. I have not gotten a letter from the DOJ saying you do not need to do that anymore.
Got it. Any final messages? Final message or messages to the GV Wire Unfiltered audience about guns, gun safety? Are there any new guns available, by the way?
Absolutely. You're seeing
Handguns?
one on the
Okay.
screen right now. You're seeing the Springfield Echelon and the P365. That's just kind of something out of our own creation. We did expand on a lot of vendors in the shop this year. The Echelon and the Smith & Wesson M&P 2.0 are nice and hot right now. We finally started getting them in California. They're kind of filling the gap of what Glock left after they got kicked out of here. So those two, the Springfield Echelon as well as the Smith & Wesson M&P 2.0, great guns right now.
Got it. I think we had, let's put up slide 19 again. This is one of the guns, the new guns. Is that correct?
Yes, that is the Springfield Echelon.
And you have those, you carry those?
I do. We
Okay.
carry those. We carry the M&P 2.0s as well too.
Awesome. And your shop, gun store, you feel comfortable disclosing what part of town it's in? And if somebody wants to come in and buy a gun or get
Absolutely.
instruction or know the laws, where do they go to your website? Oh, there it is.
You
That's
can go to the
your
website to get a little bit of information. The best thing to do is give us a phone call or stop on in. We're open Tuesday through Friday, 10:30 to 6, and Saturdays, noon to 4.
Awesome. Awesome, Leon. Please stay on because this is going to be, if you want and if you have time, this is going to be really interesting,
Okay.
fascinating. We're going to talk about public service and education. Oh, actually, hold on. One quick question before we get. Dina Esparza says, as a single mother of 2 kids, what type of a gun do you suggest I purchase?
That's something we can kind of get into in a conversation. For home defense, I always recommend a shotgun. That's pretty standard. If you're looking at getting your concealed carry or just to have something around the house, there's several different pistols. I recommended the Springfield Echelon, the Smith & Wesson 2.0. Your 6-hour P365s are always nice, as well as your Hellcat Pros.
Okay. And for more information, let's put Leon's phone number and info. Feel free to contact Leon. Let's see, a couple of comments. Politicians that vote for law determined on politicians that vote for a law determined unconstitutional should go to prison. That's Eddie Freedom. Rebecca asks more. I cannot tolerate the news much more than an hour. Most of the time, SM is where I get current updates. Thank you
Well,
for those, Leon.
That was a great point that someone brought up with the politicians of unconstitutional stuff, because the problem we're having right now in California is that these laws, because you also had on your banner of, does this make us safer with these new things passed? It really doesn't. Looking at the system, and again, we do everything by the book here. However, when you've been doing it as long as I have, you see the weak points. Basically, if you're buying a barrel, let's say, one of those restricted items that you can't send to your house, but you can send to me, you fill out a simple piece of paperwork. There's no background check. There's nothing going on. By no means am I suggesting background checks for this stuff. But what I am saying is that it's an easily bypassable system that really doesn't do anything. You know, it would be hard to audit on the other side of doing an inspection, such as how many barrels did you sell? Okay, well, here's a stack of paperwork.
Yeah.
But you can easily, as an FFL, and again, we're not doing this, but you can easily, as an FFL, just kind of slip one out the back door, which defeats the whole purpose. The other thing, the rest of America doesn't have to do this. So that has to be some type of violation of our rights of not being able to get these things or having to jump through extra hoops to get these things.
Okay. One final question by Mike Schwabenland, and if you can give a brief response, because we got a lot to cover on the other topics. Mike says, I was recently involved as a crime victim by a minor. He has previous felonies using a firearm. What should I be worried about? Firearms and minors are a special issue. Please expand the topic, which could be at a later date.
Yeah.
Any thoughts on that?
I'm not
Leon?
understanding the question. What's the question again?
I'm not understanding it. I guess he was a victim of a crime by a minor who used a firearm. I guess Mike should contact law enforcement or the district attorney for further information on what to do.
Absolutely. Okay. One of the things that we do say, we're not attorneys here. We can kind of advise, but we are not attorneys.
Got it. Yeah. And there's lots and lots of laws, current, past, future, coming in California. Okay. Leon, as always, thank you for joining us on Unfiltered. If you have a few minutes, stick around. This is going to be a really fiery discussion about how should we treat our retired teachers and public employees, especially people in the education business. Let's bring on Susan Wittrup, and also Larry Moore and Emily Brandt on the screen. Welcome back again to all of you. Welcome, Larry and Emily. Welcome. So let me just briefly say this. And I've been thinking about this as I'm reading some of these articles and talking to the staff, to our staff. There's a lot of folks, there's some folks that go, we just want to go to work for a public organization, public agency, because we know after we retire, after X number of years, I don't know what the minimum is, 25 years, 20 years, we're going to get X amount of money per month in retirement. And some or most of that money has been taken out of their paycheck over those 20 years. But also we're going to get lifetime benefits. We want health care. We're going to be in our 50s or 60s or 70s. And, how are we going to come up with money to take care, buy health insurance or take care of, medical services? So there's folks that go, I can't get that in the private sector. Because once you retire, you just have your 401k in the private sector, and unless some particular company offers lifetime benefits, you don't get those. But you get those in government, and especially in education. And from what I understand, and I'm going to start with Susan Wittrup, trustee, Fresno Unified, to explain this. From what I understand, Fresno Unified or their insurance company or Clovis health systems or community health systems, it's one of those three organizations that said, you know what, we used to cover you guys, but not anymore. You need health care, you need treatment, you need expensive treatment. You're kind of on your own. That's my understanding of what's shaped up. And Susan Wittrup put a Facebook post up January 2nd. Let's put that up for a minute, and then I'm going to bring all of us back. There we go. I'm going to leave it up there. It's on her Facebook page. I did get her permission to share it. Has 69 comments, lots of shares, lots of folks are very passionate about this. And then this goes back about almost 2 weeks ago. I'm gonna leave this up there for about a minute so folks can get a chance to see how this thing started back on January 2nd, and then it just kept going and going, and then GB Wire picked it up. I know Susan has been contacted by several other media outlets, And but Jimmy Barr had a great story up last week on what this stuff means, and then of course a lot of other folks have picked it up, and I'm sure there's a lot of other news agencies are going to pick it up in the next few days. So Susan, kind of give us a brief 5-second. No, I'm sorry. A brief update on what's the issue, and what is the issue? What is the problem? How does it impact the retirees? And in your opinion, what should be done about it?
Thank you for having me on. I just want to start by saying that nobody goes into education for the lifetime benefits.
Okay. Okay.
Teachers are called, educators are called. It's a passion of love. Nobody gets rich. Nobody gets bonuses. And sometimes, as in this case, teachers gave up compensation when the district was in a real financial fix many years ago, and lifetime benefits was something that we accepted in lieu of pay raises. Okay, and that impacts your salary, your retirement, all of that. So that's great. We have lifetime benefits. It's been brewing for a while that there's been a negotiation impasse between Aetna Insurance and our own local community medical systems. Okay, and usually these happen and they get resolved before the end of the year, which is what we were all hoping would happen. But this time it did not. Aetna and community are at an impasse. So those calls and text messages and emails started frantically coming in to me January 2nd from friends of mine who are retirees who were being denied care at urgent care in town, that they were in terrible circumstances. And it took me a while to really understand what was happening here. But what I learned was that when Aetna and community come to a negotiation impasse, as they have now, community has a choice. They can continue to see our Fresno Unified retirees and accept the Medicare reimbursement that they accept for anybody that walks in their door who has Medicare, anybody in the general population. And they have decided instead to use our retirees as a bargaining chip by denying their services, canceling their appointments, canceling their chemo and cancer treatments, their surgeries, and really have left them stranded. And these are folks that are of Medicare age. They're folks that are in some of them that I've talked to in their 90s, in hospice care, in rehab, needing life-saving surgeries, and community will not see them. And,
Wow.
and so that is, and those community is our local medical provider. I mean, they have 10,000 employees versus St. Agnes, who is continuing to see our patients and who has really stepped up in this crisis. I want to thank St. Agnes, but they only have 3,000 employees. They're a much smaller organization. So in a nutshell, just very quickly, that's kind of what's going on right now.
Thank you, Suzanne, for that background and on the facts on the ground and what's actually shaping up between the retirees and community health systems. We did reach out, I want to say for the audience, we did reach out to Aldo De La Torre, the division president of community health systems in this for the insurance issues, and I don't have his exact title, but he couldn't attend tonight. They want to negotiate in good faith, so he wasn't, but he did. Paul Marshall sent him an email, and let's put that slide up, and then I'm going to bring Larry and Emily also to join us in this discussion.
I'd like to comment just one more time after you bring that up.
Okay, great. Question, this is actually Susan's question to Mr. Aldo De La Torre. can community choose to accept traditional Medicare reimbursements from Aetna during negotiations, just as they do for the general public Medicare recipients? That was a question that was asked.
That was
And then-
unanswered.
Was unanswered, but we got two other comments by Aldo de la Torre. Can we put those up now, please? There we go. Excuse me. So upon Aetna's approval, this would allow community provider to continue services for up to a year for that patient. And then again, quote unquote, another quote, our ability to provide high quality, accessible care to the entire community depends on contracts that fairly reimburse physicians, nurses, and care teams for the services they deliver. To date, Aetna has not offered terms that meet that standard. Again, from end of quote, from Aldo de la Torre Community Health Systems.
So
Susan, you had
I
a
have a
comment on
about that. Okay, if community is practicing in good faith, I have to ask, where is the good faith in leaving our retirees stranded without health care, leaving somebody with a brain tumor in San Francisco without a medical team? There's no good faith in that. And I believe you have a slide 32 that shows the contract language that says community could absolutely accept during this interim of negotiation impasse, they could absolutely accept our retirees for traditional Medicare reimbursements, and they are selecting not to, probably as a negotiation tactic. I don't know any other reason that you would voluntarily decide to reject people and leave them without care. So I'm disappointed that they weren't willing to come on. I think it would show good faith if they did, but to hide behind this when so many people are suffering, it's just shameful. It's absolutely shameful. And I'm not happy with Aetna or community. I hope that our legislators in California will address this and make it illegal for this to ever happen in the future. Community right now is playing a life or death game with our retirees, and they need to stop that immediately.
Okay, before I go further, what should happen right away? And then I'm going
Right
to bring
away?
Larry and Emily back up. Okay.
They should right away start seeing our retirees immediately and accept traditional Medicare reimbursement just like they do for the rest of the general public.
Can the board, I don't want coerce or ask, or can the board of trustees take a vote? Yeah, there's a board meeting tomorrow night. Can the board of trustees do something like that, or how does that work?
It's community, the power is in community's hands. They, as a part of our contract or their contract with Aetna, during negotiations, Aetna will reimburse them at traditional Medicare rates. Okay, they accept that from anybody that walks in their door, they accept Medicare. Why they are choosing to do this now just reeks of a negotiation tactic, and it's harming people in our community.
And Paul has the list of the community health systems board of directors, and which will be on the GB Wire website for those folks that want to know who they are and to contact them. Let me bring Emily and Larry Moore back up. Thank you, Susan, for that intro and explanation. So it sounds like it's a community health system says we can, Aetna has agreed to pay the same rate as Medicare or does, but community health systems is saying no. Is that correct? We're not going to see you, and we're not going to take that money. We want a different rate. Is that?
That is correct.
Okay, Emily and Larry more, please jump in. Is that your experience?
Well, this is a national s- catastrophe. Medicare Advantage charges differently. It operates completely differently. It is a for-profit managed care plan with shareholders. They must make 15% profit in order to maintain profitability. Um, in the last year, they have lost 1.2 million providers. Okay, so what we're really looking at here is the provider, community is the provider. Medicare Advantage is the Medicaid, the insurance. It does not work the same way as Medicare traditional. Medicare traditional was managed by um, our benefits department. It was an in-house self-funded plan, not a for-profit plan, which is re-upped every year, renegotiated every
So,
year,
so
which it's
Emily,
why, yeah,
Emily, let me ask you. So it sounds like, can you just, I mean, I'm not in the healthcare business
right,
and the education business. I'm trying to understand this. So
yeah,
if you wanted to go get, you're a retiree, I'm assuming,
I
right?
am, and I've been
You're,
denied.
okay, so you want to go get some kind of a medical service, and you've been denied because of this, because community health systems is not providing the, is not
Well,
allowing you, is not allowing Aetna to pay
well,
Medicare. Is that correct?
exactly. It is, and but the reason that community is not allowing Aetna is not able to work with Aetna is their reimbursement rate is extremely low for 2026. Now, I want to hear from community hospital what the actual numbers are. I agree with Susan, but I want to see the numbers. What is what does Aetna, I'm sorry, what does Medicare traditional pay in reimbursement for different problems, different health issues? And what does Medicare Advantage pay? We have a
Okay.
right to know this. This is absolutely central. Otherwise, we're talking about what? You know, when I talk to community, as I did today, they told me, well, if we pay even Medicare's rate, then it simply shows that we are in network. We're not in network. So
But let
we
me let
need
me
answers.
we need great point. Let me bring Larry on.
Yeah.
So in a nutshell, again,
Hmm.
you can't get any service, any medical treatment
No.
right now, currently. If
And
you're a retiree from Fresno Unified, you cannot. Is that correct?
no, we're all turned away. I'm getting phone calls. My treatments, which are $30,000 a shot, I won't be able to do that. But I can go to Boston to the Dana Farber Cancer Institute, and I can get treatments there because they accept our plan. But I can't work with my doctor who is coordinating with them because they've been cut. They are no longer accepting Aetna.
That's incredible, Larry.
Yeah.
By the way,
Well,
former
yeah,
FTA, right? So
yeah,
you have incredible credentials. Former president of FTA, and of course a retiree,
yeah.
Fresno Unified.
And I was also on the school board
Yes.
for one term. Uh,
Okay.
I think we have to look at this as one is long term, short term. Short term, many retirees are being harmed in Fresno because the I don't know the size of the community, but I assume they're one of the largest providers. Has will not accept Aetna Medicare Advantage program. That's an immediate concern. And I think from at today is the school district and the superintendent, Missy Herr, their challenge is to really see what can we do? We can use the bully pulpit. We can talk to community and see if they will accept out of net, it's called out of network, because they are not, they have a legal right to not accept out-of-network patients. Now, the problem is Fresno Unified health plan for retirees has a very good, very generous out-of-network provisions. And if they go out of the network, they can still be covered at the Medicare rate. The problem is for us is that the community has a choice, and they chose not to accept that from Aetna. So that's the problem. We have a lot of people are being harmed. Long term is to look at the bigger issue of what is the longer solution, because it is a problem in the United States. It's a problem in California, is that many more providers are rejecting Medicare Advantage type programs. It's important to understand, I believe, that Medicare Advantage is really not Medicare. Most people, we understand in the United States, you pay Medicare tax all your life. When you retire, you're at 65, you go into Medicare. Medicare pays the doctors 80%. In Fresno Unified, the 20% left over that isn't paid is then picked up by Fresno Unified. When Fresno Unified 3 years ago changed from Medicare to Medicare Advantage, they went and they purchased a private insurance program from Aetna. So technically we're not in Medicare. We're with Aetna. Aetna pays the 80%, and then also they pay the 20%. The plan is very good. The problem is that too many doctors and too many providers are not accepting Medicare Advantage anymore. For example, in San Diego, the largest group is Scripps Medical, and they will not take, not just Aetna, they won't take any Medicare plan. And thousands and thousands of people last year had to find doctors elsewhere, and they got thrown out. Now, it's complicated, but it's important to understand that 3 years ago, Fresno Unified made a choice to pull their retirees, not their regular employees, but their retirees, into a different network. We're in a different insurance plan than the regular employees. So consequently, we're under private insurance. So private insurance, Aetna decides, it's a managed care. They decide what is covered. Well, they don't decide what's covered, but they decide they have requirements that Medicare doesn't have, and it's more challenging many times for patients. And it's a complicated issue. But the fact is that if community right now, immediately, if they accept it out of network, which Fresno Unified is very unusual, their plan with Aetna allows full coverage. There's no cost for the patient, and they will pay the Medicare rate. So it's not a bad deal. I can't speak to their motivations. I don't know what their motivations are. But let me give you another example. Stanford Medical Center, that's a pretty famous group in California. They're not in Aetna network, but many retirees, many people from Fresno for certain specialties, they go to Stanford Medical Center. Stanford Medical Center, unlike community, they accept out of network. That's simple as that. And I know that for a fact because I looked up in Aetna and they're not listed, and I called Stanford and they said, well, yes, we're not in the network. We're not any of those networks, but our policy is we accept them anyway, and we bill Aetna. So there's two options here. All right.
Could you again distill the two options real quickly for the audience in 10 seconds or less?
Which two options are you referring
The one you were just talking about. What options are?
Well, the options are, if you're in Medicare Advantage, you're in a different network, totally different network. It's much smaller than we had previously with Fresno Unified was the insurance. I think it's important to understand that Aetna's for profit. Fresno Unified is very unique in Cats, one of a few school districts that are fully self-funded school district, which means they are the insurance company. So they pay the doctors. In Medicare Advantage, Fresno Unified pays a fee, a monthly fee. They purchase insurance. Aetna pays the doctors. So if we were still in the Medicare and in Fresno Unified would be paying community. Medicare would pay first, Fresno Unified would pay second. That's the way it was done for 50 years. But because now we're in Medicare Advantage, you run into these kind of problems because they're not dealing with Fresno Unified anymore. We are not part of Fresno Unified. We're Aetna is our insurance company, no longer Fresno. So we're at the mercy of what happens with Aetna and with community.
Thank you for that great explanation, Larry. Let me put a quote up by Superintendent Misty Herr. That's slide 25. I recognize, quote, I recognize there is concern regarding recent changes in medical coverage for our retired district employees. And I understand this is a scary time for many as it impacts not just Fresno Unified, but all organizations that use Aetna as a health provider. So it sounds like Misty really understands that this is a scary time. But now we got to figure out, understanding the problem is part of it. Now we got to come up with a solution and then an execution plan and all the consequences of the execution plan. Sometimes these things cost money. Sometimes they don't. I mean, look at it. Again, I'm not in the healthcare or education business, but if I thought Susan is correct, thank you for correcting me. People don't become a teacher because they go, I want, permanent or lifetime benefits on healthcare. But it's an advantage. There's folks that go, I'm thinking of leaving Fresno Unified, but you know what? If I stick it out another 5 years, I'm going to get healthcare for life, and that becomes an incentive to stay. And all of a sudden, oopsie, you're no longer that is no longer the case. It's kind of my opinion. It sounds like a bait and switch. I hope I'm wrong. I hope it's you guys are explaining it. But, and Misty sounds like she understands there's a problem, but you know what? Understanding a problem, and I wish Misty was on, and she's been invited multiple times to this program. Identifying the problem is part of it. We got to come up with a solution and execution. People that need care, emergency care, surgery. We're not talking about a headache. We're talking about Emily Brandt, who needs, transfusions and care to. I don't want to make assumptions, but to live a healthier life. And all of a sudden they're told no.
Well, and they've canceled all of our appointments. Excuse me for interrupting.
No, please, go ahead.
These are people who have scheduled a transplant, a lung transplant. That lung is no longer available. So it made me a little uncomfortable in our conversations. I appreciate the speed and intensity of everyone's efforts to get community to get us back in place, but all those appointments are gone and they've been filled with new people. And so what is going to happen, as you said, Susan, to the lady in San Francisco with her husband who just had in December 26th, and they only started in December with the knowledge that he had a brain tumor.
Wow.
Yeah, it's not a good situation. That it is an awful situation. But you mentioned the superintendent. We met with the superintendent yesterday. I think it was yesterday. Sometimes I'm getting old, but I believe she's sincere. I think she's committed to looking for a solution. There's a long-term solution, and she's committed, I believe, with us to address that.
Right.
Because we used to have a choice. And when they moved to Medicare Advantage, they dropped the choice. For example, for many, many years, retirees had the option of going to Kaiser. That was a choice. Kaiser Insurance is a Medicare Advantage option also, but it was a choice. They could remain in Medicare, or they could move to stay in the Fresno Unified plan. It was a choice. But when they moved to Medicare Advantage, they moved everybody into the plan and they ended choice. So long term, we believe anyway, the solution is to restore choice so that if people want to remain in Medicare, they can. If a Medicare patient goes to community, they accept it. They have to accept it because virtually every doctor and hospital in the nation accepts Medicare. The problem is they don't all accept Medicare Advantage.
Exactly.
So what we want is to restore a choice. So a retiree, I think, is smart enough to realize what's the best option for me. Should I remain in Medicare and then Fresno Unified is a supplementary, or should I enroll in a Medicare Advantage? That's fair, that's reasonable. Now, Medicare Advantage, there's nothing wrong with it. It can be great because they offer a lot of things, extra benefits, no premiums and so forth. So it can be very attractive. And Fresno Unified plan is very good. But it should be a choice. And if it were a choice, all of the people that wanted to be in Medicare would be going to community, and community would accept assignment. And then by law, they would have to bill Fresno Unified, and Fresno Unified would have to pay the remainder.
Okay.
So that's one of the difference. Now, what the solution is locally right now, it's a real challenge. All I can tell you is that what Misty Herr told us yesterday, and I believe her, and she is committed to being proactive to assist all of our retirees to find either whatever is necessary and to assist them, because we have a lot of retirees. I'm pretty young. I'm almost 80. But we have a lot of people that are 88, 89, 90.
You look awesome, by the way.
Right.
You look awesome.
Your ability to navigate all this stuff is a challenge, and they don't. Insurance companies take advantage of them, and whether that's community or Aetna or someone else. Medicare, not so much. Medicare's government. The doctors love Medicare because they decide what is needed, and if it's covered, Medicare pays it. Flat out.
Thank you, Larry. Let me bring Susan in, and then I'm going to go to Emily. Susan, what are the next steps from the board's perspective? And I know the superintendent reports to the board. So what are your what do you see as next steps? You have a board meeting tomorrow night. I don't know if this is on the agenda or not.
So I want to start with saying that everybody on the board, all my board colleagues, and our Fresno Unified District Administration are on the same page here. And with FTA, we're all on the same page. How often do you hear any of us say that? We had a press conference yesterday. Our president of the board, Beva Islas, spoke articulately about this. So did FTA President Manuel Bonilla, and so did Misty Herr. We are very committed to working through this and making sure our retirees get the health care that they need. There are two problems. One problem is the short-term,
right,
I hope, short-term health crisis that we are facing in our community right now, where people are not getting care. They're being denied life-saving treatments in real time right now. That is the short-term problem. Community could remedy that in a second by just accepting, according to their contract, and accepting Medicare reimbursements while they are at an impasse with negotiations. The longer term problem, the problem that is not an emergency for these folks right now, but it is an issue, is that people are very unhappy with the Medicare Advantage plan. The people that I've been hearing from. And so choice is very important. And there are many people that are asking to go back to the same kind of policy our active employees have, where it's supplemental to Medicare, it's secondary. Medicare would be your primary insurance, and Aetna would be the supplemental secondary policy. I am hearing positive things about that. I don't want to further complicate or confuse anybody with our Jimby board, but that is something that is supposed to happen Thursday. They're meeting. I'm hearing positive things about them making moves to offer choice. I don't have any more detail than that, but I'm very happy to hear that they are taking action on this. The problem that I would like solved today, tomorrow, the next day is for the people that are now left abandoned in their elderly years without access to life-saving medical treatments that they need. And that is the pressing issue right now.
Are you planning on contacting anybody at community?
I'm going to start calling their board members. Yes.
And I was just looking at the list of the board members. I think you know one or two of them.
I do know one or two of them, and
Okay.
and I think that's my next step. If I don't hear something tonight about this impasse, then that's my next step, is to start personally calling board members who all live in our community to make them aware of what's happening for our retirees. I don't know that they're aware, but I would like to make sure that they are aware so that they can remedy this.
Thank you, Susan, for that. Let me, Larry, before I bring you back up, let me bring Emily. By the way, Emily, very cute scarf you have on.
Well, thank you. I'm so
Okay.
glad, Darius, that you appreciate it.
Yeah,
I
thank
wear
you.
it everywhere.
Great. You had a comment?
Yes, I just wanted to point out one of the differences Larry is referring to between Medicare and Medicare Advantage is Medicare covers a wide range of things. They accept doctors' diagnoses and prognoses, and they act on it. Medicare Advantage is excellent for people who are very healthy with a zero copay, zero deductible, and so forth. You imagine that their actuarial chart is pretty much based on being healthy. So if you are not healthy, you are going to be denied. You're going to have one case after the next. Our friend Bev Fitzpatrick, who taught for many years, was very beloved in the community. She had valley fever, a very difficult diagnosis. She went through one denial after the next, and eventually she died. And we have other stories like this. Um, that is why we all know that Medicare Advantage, it does not work for us. We're sick. So our only choice is to pay out of pocket unless we have this wonderful plan. We just want to make sure it's really implemented. So
Thank you
thank
for
you.
that.
Yeah.
Thank you, Emily. Larry, before I bring you on, Elizabeth Robledo comment on our post. A single pay funded system like Fresno Unified offered a human touch, which is something that Medicare Advantage does not offer. Potentially could lead to the process of a humane negotiation process and allowing folks to make these decisions on an individual basis rather than as a blanket system in order to make a profit
Exactly.
at 15%.
Yeah.
Linda Sawaski, thank you for fighting for my husband's cancer treatments at Community Cancer Care Institute.
Absolutely.
Wow.
Welcome to Insurance from Eddie Freedom. We have just a couple of minutes left. I'm going to get closing comments, but before I get there, Larry, you had any other comments pertaining to what Emily and Susan Wittrup were discussing?
Yeah, I think short term, let's put pressure on all the parties, and that includes Aetna. Let's get them to Aetna and community together and get a solution for our community. I assume these board of directors are members of our community. Hopefully they care about people in the community. So that's the immediate problem. The long-term problem is let's restore choice. That's what retirees want. I'm not opposed to Medicare Advantage. It can be a great thing, especially if you have zero premiums and all the extra benefits they have. But it should be, and under the law, when they started Medicare Advantage, it was designed to be an alternative, free choice to Medicare, not a mandatory. But at some point in time, group plans like Fresno Unified decided to move everybody in to Medicare Advantage. And to us, that's not respect. That's not choice, and that's not fair and respect. Let the individual tire. We're pretty smart. We can figure out what insurance is best for us and what the best plan is. Fresno Unified's philosophy for many, many years was expand choice, add alternatives. Adding Medicare Advantage is a great thing. Then retirees have a choice. If they like it and it works for them, they should go to it. But if they don't want it, they should be able to remain, as promised for many years, in the Fresno Unified District Health self-funded plan. People don't realize, they think Aetna's, Fresno Unified purchases Aetna insurance for active employees. No, they don't. Fresno Unified is the insurance company. They pay the bills, okay?
Thank you.
That's passionate on my part, but I really feel for the retirees. And I know many retirees. Emily has already, she personally went and contacted community to get them to change and find out what's going on. So we're working hard to do it, okay?
Thank you, Larry. Emily, your final comments, and then we'll wrap up with Susan. By the way, there's one other segment that I skipped, and I'm glad that Mike Schwabenland reminded us, and that's what happened with ICE and Board of Supervisors today. That'll be really brief after Emily and Susan.
Okay. Well,
Emily?
thank you. Thank you, Darius. You have really been a trailblazer here in giving us the opportunity to speak like this. For too long, everything has focused only on information coming from one place. So thank you. Susan has opened doors for us. We're very, very grateful for that, because she has taken our part, because she has had the experience. Um, we need people to understand how complex this is, and it's only complex because we were kept in the dark. We were kept in the dark. We need to go back to what we had with a human touch. Thank you.
Thank you for those comments, Emily, and some of those comments refer to you, Susan. So I'm going to now turn it over to you for your final comments.
Good.
You started this thing on a social media post January 2nd. And
first of all, it's been a pleasure working with Emily and Larry. Larry, I remember you from way back in my youth when you were the trailblazer, setting everything on fire in Fresno Unified. I remember it very well. I'm just very grateful for all the retirees who have reached out, who have told their lived experiences and shared them on social media with me by phone. And I'm very grateful for all of you. And for me, I have to say this is personal, because when I looked out from the press conference yesterday at the retirees sitting in the boardroom, these are the people I saw. I saw people that trained me. I saw people that mentored me. I saw people that worked with me so closely, and we had children's backs to take care of them, to teach them, to make sure they had everything they need in all kinds of circumstances across this city. Those are the people who are being denied care in their most vulnerable, needy moments. Those are the people. These aren't just faceless people. They're people that I grew up with. They're people that worked with our children. They're our aunts, our uncles, our grandmothers. These are personal people. I mean, this is personal for me. I want them taken care of. It's something that we agreed to do as a district, and we need to do it right. So I want the short-term crisis addressed, and I will continue to fight for that to happen. And I want the long-term choice added back in. Those are the things I will continue to fight for. And I just really appreciate everybody who has shared their story and continues to work hard to get this right, including my board colleagues and the district, our superintendent, Misty Herr, and Fresno Teachers Association. Thank you. You're all fantastic advocates.
Thank you, Susan, for those comments. Thank you, Larry and Emily. Sounds like there's some really simple solutions. And again, this was just brought up to my attention just a couple of weeks ago. I'm really glad that Unfiltered is a great avenue and a conduit to get this message out. And I'm sure after tonight, a few other stations will pick this up and probably contact all of you guys. Spread the word. Several other comments coming in. Elizabeth Robledo, appreciate the trailblazers. This is personal. Yes, it is. Susan Wittrup articulated really well. These are the folks that have taken care of us. I mean, you guys helped us, educated us, kind of in a way raised us. And now we're going to, as Susan said, we can't turn our backs. And Emily said that, and so did Larry. We can't turn our backs to the folks and basically said, you know what, you took care of us. You did your time, and now we're not going to take care of you. So I'm really disappointed, and I hope that this thing, you get great results. Susan, thank you for your leadership and getting in contact with community health systems to see if you can stop at the very, very top of that organization and hopefully get some results for our well-deserved retirees. Before we go, something happened today. I wasn't aware of it, but we have I'm going to put this on the screen really quick. There you go. Fresno County officials condemn attacks on ICE, urge support for law enforcement. That was a press conference. Supervisor Gary Bredefeld and also Nathan Maxick was there and a few other folks. I don't have the whole list in front of me, but several members of the Board of Supervisors, I think including Buddy Mendez, were at this press conference urging support for law enforcement and condemning attacks on ICE. For that full article, please go to gvwire.com. Okay, let's get all four of us back on. Okay, again, thank you, Susan Wittrup, trustee, Fresno Unified for the Bullard region.
Thank you.
Which I'm one of your constituents. Thank you for your leadership in this. Thank you for firing it up. And I want to really say thank you, Facebook, for allowing so many comments. I was just looking at your page. You have 69 comments already. If anybody has questions for you, Susan, should they reach out to you on Facebook, email you? How should they connect with you?
They can reach out to me on Facebook. They can email me at my district email, which is susan.wittrup@fresnounified.org.
Okay, great. And then Emily and Larry, I don't know if you need I don't want to put your personal contact info on the screen, but if you want to share, feel free to.
I do have a Facebook page. It's Emily Battles Brandt. You can reach me there. And Larry and I and 649 others have a group page, which is really wonderful, called Fresno Unified Retirees Lifetime Benefits Group.
Great. Awesome. Larry Moore, Emily Brandt, Susan Wittrup, thank you so much for joining. Of course, Leon Orndoff earlier kind of educating us on all the issues going on with the state. But thank you for joining us. Thank you for shedding light on what needs to it really needs to shape up, and hopefully get this issue addressed over the next few days. Stay tuned for more on GVWire. There'll be a lot more articles and videos coming out from tonight, starting tomorrow morning on gvwire.com.
Yeah, I want to thank GV Wire. You're doing a great service. This is a good organization. Thank you very much, because people want to know. They want to know.
Thank you, Larry. Thank you. Thank you all. Thank you to our viewers, and hope this was informative, and hope to see all of you next Tuesday night. There is a Fresno Unified Board meeting tomorrow at 4:30, and there's, oh, by the way, Jim B meeting. Paul, do we have a graphic with the Jim B folks? Who is Jim B? When I first heard about this from Susan, I said, okay, Jim B, what? It's an acronym, and I can't remember what exactly it stands for. If we have that, let me see, Paul, let's see, slide 24. Yeah, let's put slide 24 up, please. There it is. This is our Joint Health Management Board members. And there's a meeting on Thursday that they're going to meet. I don't think it's open to the public, but they're going to be discussing a few of these items. That's our Jim B board. Okay, more to come from GB Wire on all
Great.
issues local, national, and international. Thank you all. Have a great
Thank
week.
you.
night.
Thank you
Thank
And see
very
you next
much.
week.
Bye-bye.
Take care.
Goodbye, everybody.
Good night.